This is the second video in the two-part series discussing what you need to know about the RCA or recorded consultation assessment. This is the practical exam you need to pass in order to complete your training and become a GP. In the first video, we looked at exactly what the RCA is, the areas of the GP curriculum the exam covers, including what cases trainees should submit, and obtaining consent, the format and structure of the exam, and new changes for this year. So if you haven't seen the first video, then be sure to check it out here. In this video, we'll be looking at how to apply for the exam, including key dates to make a note of, how you can prepare for the RCA, how the exam is marked, key information regarding results and feedback. Hi everyone and welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP. On this channel, you'll find lots of useful content to support you on your medical career journey. As always, if you enjoyed the video and gained value from it, then be sure to give it a thumbs up and subscribe if you haven't already. So let's get into the video. So you'll need to book the exam on the RCGP website. Once you have successfully booked the exam and it is confirmed by the RCGP, you'll be sent a link to access the FourteenFish platform. From there, you'll be able to submit your recordings, or you can even record directly to the platform. You and your trainer will need to confirm your identity and that the recordings are from real or genuine consultations at the GP surgery you are assigned to. So the trainee chooses the consultations and the trainer does not have to review them. The RCGP do make it clear that trainees cannot use consultations that have already been used for workplace-based assessments. So here is a page on the RCGP website which shows you a list of important dates such as booking, the assessment periods, and when the results are released. How do you prepare for the exam? The best and really the only way to prepare for exams, and in particular this exam, is to practice. There really is no way around it. You should practice daily in your clinics with the patients that you see. In this video here, I talk you through some of my top tips for life as a GP trainee. Of course, you should also make sure that you form a study group really early on. Being observed directly by different trainers and experienced doctors will help build your confidence, and fast. Here are 10 tips to help you prepare. Focus on your own unique consulting skills. You should start developing your skills from day one. As soon as you're an ST1, focus on building a strong foundation which will only get stronger as you make your way towards the end of your training and ultimately become a GP. Try and select the most appropriate consultations which will help you demonstrate the best of your knowledge, skills and qualities. After all, you want to show the examiners your strengths. Receptionists and triage clinicians can help in selecting the right patients. This might include patients with a new diagnosis, such as diabetes or hypertension. Ensure the cases are varied. The cases should be challenging enough to show you are safe as a clinician and can practice independently. You also need to have enough evidence to cover all the 3 domains that are assessed. Be wary of follow-up consultations because you may be perceived as not actually adding anything to the consultation. Follow the guidance carefully because if they are breached, you will receive no marks. There is mandatory guidance in the following areas: examination of patients, continuous recording, and case selection criteria. Make sure the environment is set up to help you. By this I mean you may want to use a timer to help with keeping to time. You may want to ensure you are not disturbed. Perhaps you can place a do not disturb sign on your door or let staff know what you're doing. Can you place some reminders on your workspace, such as to check identity or ask for consent? Be patient, not doctor-centered. I know it can be nerve-wracking when you first start consulting or when you are being observed, but try to ensure you really listen to the patient. Let the patient guide you and ask the relevant questions at appropriate points. Think of the consultation more like a conversation. Demonstrate intellectual curiosity and be the patient's advocate. Don't forget to safety net and do so appropriately. Make sure you explain to the patient the likely time course of the illness if you can and what symptoms to look out for, which means their condition is not improving or getting worse, and where they can go to get help. In the case of mental health issues, perhaps they can contact the crisis team or the Samaritans. They can also call NHS 111 for medical advice 24/7 and of course A&E and 999 in emergencies such as severe central crushing chest pain, as you know. Use ice appropriately. Sometimes patients already present their ice to you. Their ideas, concerns and expectations can be present very early on. So where this is the case, do not ask again. Try to find a way to elicit the ice without sounding artificial or patronising. And don't let it get you down. You may feel at several points during your exam preparation that things are not going the way you had planned. You may forget the guidelines. You may not elicit all of the patient's ice. You may miss crucial information. Stay positive and focused because you're probably doing better than you think. I wish I stayed more positive in my exam. I talk about my exam experience in an earlier video that you may want to check out. Look after yourself. You need to ensure you stay on top of things, but you also need to ensure you have plenty of time to rest and look after your own mental well-being. Do not sacrifice time with family, friends, or doing the things that you enjoy for revision. Schedule small amounts of regular me time and time for doing the things that you enjoy. This will only enhance, not detract from your revision and exam preparation. How are you marked in the RCA? There are 3 domains which are data gathering, clinical management, and interpersonal skills. Examples of each include data gathering, taking a focused history and rules in or out serious or significant disease. Clinical management and decision-making skills, makes a safe and appropriate working diagnosis or safe management options for the presenting complaint. Interpersonal skills, encourages the patient's contribution, identifies and responds to cues appropriately, and explores the patient's agenda or health beliefs and preferences. For the full breakdown, you can visit the RCGP website. Each domain will be graded in the following way: clear pass, pass fail, or clear fail. The camera should be turned on continuously and not be turned off. There are feedback statements on the RCGP website which you should use when you're practicing. Make sure you read them and know exactly what you should not do. You may want to also have a look at the summary of results for the different cohorts and the interim report on the performance of the RCA. So those are a few top tips and key information to help you prepare for this RCA exam. I know you'll pass, so have confidence in yourself and stay positive. As always, if you gained value from that video, then be sure to give it a thumbs up and subscribe if you haven't already. I'll see you in the next one.